Crew.
All right, so let's go to the CPR section in the book. We'll bust through this. What page?
It's a going.
So there are a lot of pages here to this, but they're all, engaged with these brackets around the 44. So the pages before it go a lot into cardiovascular challenges that can happen, cardiovascular disease. I think we've talked a little bit about some of this, but not more. So let's press through some of that first. So we'll start on 39. So I think we've used this image before, right? These two rib cage images. One's kind of ribs without skin, and then the other one's kind of a cross section where they cut through everything. And how does breathing happen? We talked about it. Diaphragm holds, creates negative pressure. Air goes in, relaxes, goes out. Do we have any control over that? Some, right? We can choose to breathe faster or slow. We can choose to hold our breath for a little while. But if we don't think about it, it generally just happens. So there's that. And then the heart, in the middle there. Notice it's a little bit over to the left, squishing the left lung space a little bit. Do we have any control over that? Not so much, unless you're really good at meditating. Some people can manage it. But for the most part, it's doing its own thing and responding to the physical or mental, occasionally emotional stimuli that we give it. If we're running along, we need more oxygen, it'll pump faster. If we're relaxing, it will slow down. All right. Remember when I had you tilt your head back, like a head tilt chin lift, and try to swallow? It's hard to do, so that letting you know how far the head needs to be brought so that we can hold the tongue and the back of the throat away from each other, because the tongue is primarily what blocks our throat. And if you're going to give respiration, that's useful to recognize that sort of thing. We talked about this rib cage and how it has some flexibility to it, that the sternum is connected to the ribs through cartilage that's in line. It's still the ribs, but there's cartilage there, so we have some flexibility there. When doing compressions, there is a chance that the sternum will break free, but it can't kill a dead person. It allows you to compress the heart a little better, a little easier, I guess I should say. All right. Leah, would you read CPR heart facts in just that first section, cardiovascular, down to cardiovascular disease?
Cardiovascular disease includes coronary artery disease, CAD or hypertension, HPN, congestive heart failure, CHF, and stroke, CVA. CVD is the number one cause of death, 1 in 3 deaths, or 840,000 per year. 121.5 million Americans have some form of CVD. Men have higher incidence of CVD until age 65 than women have higher incidence. 43.2% of all deaths in the U.S. in 2000 were due to CVD. Since 1900, CVD has been the number one killer in the U.S. except for 1918. CVD claims more lives than the next 5 leading causes of death in the U.S.
We know why 1918, right? Spanish flu pandemic. CVA. I don't think they tell you what CVA is, cerebrovascular accident, which is the more technical term for a stroke. Okay, so CVA. Cerebrovascular disease is CVD. You won't hear CVD that often, but HTN or hypertension you hear. CVA you'll hear. CHF you hear. Congestive heart failure. They have CHF. Is the way somebody might say it. Okay. So down in the bigger, their cardiovascular disease terms, any help?
Arteriosclerosis, a disease of the arteries with thickening, hardening, and loss of elasticity in the arterial walls. Arteriosclerosis, the most common form of arteriosclerosis, marked by cholesterol, lipid, calcium deposits in the arterial lining. Coronary artery disease, CAD, narrowing of a coronary arteries, coronary artery sufficient to prevent adequate blood supply to the heart muscle. Angina pectoris, pain around the heart caused by deficiency of blood supply to the heart. Myocardial infarction, condition caused by partial or complete occlusion of one of the coronary arteries. Clinical death, patient without pulse, and biological death occurs within 10 minutes of clinical death due to lack of oxygen to the brain.
Does that make sense that those last two, the distinction there? So just lack of heartbeat, but if you get it going within a few minutes, then you have a viable patient. If you carry on beyond 4 or so minutes, then we get into brain damage, and then they're saying at 10 minutes you're not going to get them back because there's too much death of tissue for lack of oxygen. Okay. This arteriosclerosis versus atherosclerosis. So one is that general one, and then atherosclerosis more specific, and that's pretty common that people will get these cholesterol and calcium deposits in arteries. As I was saying, I just got scanned for that the other day because based on my age, my doctor wanted to put me on a statin drug. She said, or you could go and get this scan to find out if you have an actual need for it. It's just like based on the age. She said, well, there's a scan. It's not covered by insurance, so it's not that much money. So I was like, let me go see if I had a problem. It turned out I got a 0. So okay. Sudden cardiac death. Here, I'll read this one. It's too scary to say. When a heartbeat stops abruptly and unexpectedly, unassociated with any illness or injury, most common underlying cause of sudden cardiac death is heart attack that results in ventricular fibrillation. So the heart's doing something. It's just not a functional beat that will move blood around. But basically all the cells are in a chaotic non-rhythm, not a rhythm. 70% of sudden cardiac death occurs at home, 18% in public settings, 12% in nursing homes. Approximately 90% of sudden cardiac death victims die before reaching the hospital. Without bystander CPR, success rates decline 7 to 10% every minute defibrillation is delayed. Approximately 250,000 people die of coronary disease each year without ever being hospitalized. Causes of sudden death: sudden cardiac death, cardiac arrest, trauma, drowning, asphyxiation, electrical shock, allergies, allergic reactions. This is out of date. Because there was a period of time where a lot of people were dying of COVID, and now what's the leading cause of death of people your age?
Overdose?
Yeah, gunshots. Yeah. Gun for kids, and then there's also auto accidents, right? Car accidents. So, actually, I'm not sure your age, might be more car accidents still, and then younger than 18, I think, is guns. It's ridiculous. Risk factors for cardiovascular disease that cannot be changed: heredity, sex, age, and race. I guess there's some risk factors depending on those things. risk factors for cardiovascular disease that can be changed. Teddy, take it away.
Cholesterol, lipid panel, total cholesterol, HDL, LDL, and HDL/LDL ratios. 10% decrease in total cholesterol may result in 30% decrease in incidence of CVD. Risk of heart attack greatest with low high-density lipoproteins, LDL, and high total cholesterol count, low HDL, high LDL. Diet and obesity. 300,000 people die each year due to obesity-related problems. 129 million people in America are overweight or obese, greater than 20% over ideal body weight. 61.2 million are obese, which is 30.0 kilograms per square meter.
What if they're trying to get to like a BMI, a body mass index or something? Not sure. Inactivity, 38.3% of Americans over 20 years old report zero leisure time physical activity. Ah! Around here. All right. I'm not sure we need to keep playing for all this, but it's interesting. So smoking's bad. Smoking anything is bad, not just cigarettes. Diabetes is bad. Hypertension, high blood pressure. So systolic pressure of 140 millimeters of mercury or greater. And a diastolic of 90 millimeters of mercury or greater. So that's just putting stress on the vascular system. So that's part of why that's not so good. 1 in 4 adults have hypertension. Alcohol. I did not know this until the last couple of years that alcohol is a cardiac irritant. I thought, oh, it chilled me out. Very relaxing. ACS, acute coronary syndrome. Maybe angina pectoris or acute myocardial infarction. Treat all chest pain as if it were a heart attack. So that's good to know. There are people who will have pain, like they're doing stairs, picking up a hill, and then you say rest, and then it goes away. That's angina. If they stop and rest and it doesn't go away, it's like a heart attack. And it can be that person who is leading to that. They have a constriction, and then maybe one of these plaques broke free and is blocking a coronary artery. And I think, as I mentioned, like when you run and you get that stitch in your side, it's that lack of oxygen, ischemia, to heart muscle in this case. All right, signs and symptoms of ACS. Pain, substernal chest pain or back pain may radiate to the jaw or left arm. The jaw and arm, that's, as I recall, more typical in men, and women tend to have the back pain more, and just sort of it's different. So it's as much as they don't get the heart attacks as often or as early, they often are misdiagnosed because all the data and all the research is done on men. So they may be anxious with an impending sense of doom. You have shortness of breath, which is made worse with exertion, weakness, nausea, indigestion. That was my grandfather. He felt indigestion for some hours and then he fell out of his chair. Vital signs indicate cardiogenic shock. So anxious level of consciousness. Skin is pale, cool, and clammy. They can be pale looking and like sweaty. So that's we call it diaphoretic. Pulse, rapid and weak. Respirations, rapid and shallow. Blood pressure, steady and then falling. And pupils pearl. So pupils are not really affected by this. The difference between angina and acute myocardial infarction, MI, is that with angina, symptoms will improve with rest, but not with an acute MI. Treatment. Maintain ABCs, reassure, place the physician in comfort, encourage rest, assist the patient with their sublingual nitroglycerin. So people have angina pectoris that will often carry nitroglycerin. It'll be in a little brown bottle because light degrades it. And helping them, let me just read through what they say and I think I'll come back to it. You may give up to 3 doses of nitro 5 minutes apart, as long as the systolic pressure is greater than 100. All right, so what can we get at the wrists and ankles, feet? 90, right? So that's close to 100. So if we can get pedal pulses or radial pulses, that's great. But it'd be better if we have blood pressure cut. It's not that likely that somebody who is carrying nitroglycerin will be found out in the wilderness. It might, risk taking, but you're sticking closer to the 911 system. So it might be more like some relative of yours in their living room. You can give aspirin unless otherwise contraindicated, meaning like they're allergic to it. Give them 4 81 milligram chewable tablets or 1 adult aspirin. So baby aspirin, those are kind of orange flavored there, it's 81 milligrams. 81 plus 81 plus 81 plus 81, 324 milligrams. So basically 4 of those equals an adult, 325, which is more common one, usually not chewable. So as long as they don't have an allergy, do not use coated aspirin or bufferin, those ones that are, because they are not as quickly effective. Aspirin makes platelets more slippery. It's not that it's not a true anticoagulant and like some other things, but it will make it less likely for a blood clot to form around the calcium plaque that is blocking. So that's where aspirin is helpful.
Aren't you also not supposed to give aspirin to somebody who's bleeding?
Correct, because it will reduce their ability to clot. I think there's some, we'll double check. I'm going to check on ibuprofen. I think there's some similarities, but not the same. CPR, here we are, cardiopulmonary resuscitation, heart, lung resuscitation. Increases time between clinical death and biological death by oxygenating the brain. Best results are from a combination of early CPR and early defibrillation. Complications of CPR are aspiration of vomit, fractured ribs, complications of not doing CPR, death. So we're used to seeing all those ads on TV where they say all the side effects. This one, if you don't do CPR on somebody, they die. So that's a bad side effect, as opposed to these other things which you might be able to remedy, right? Like turn them on their side, sweep the vomit out, get them back, and keep going. Broken ribs, they can heal with time if the person remains alive. The point of this sort of tongue-in-cheek little post there, it's like they want you to feel encouraged to give somebody CPR. Okay, you might do some damage, but hopefully they'll live long enough to say, yeah, my chest hurts. Now that you're here. That's cool. All right, so we have all these skill sheets here. So solo adult CPR skill sheet. It carries on to the next page, then solo child CPR skill sheet, which is older than 1 year old up to puberty. What is the sign of puberty? How are we going to determine it? When somebody is now then becoming an adult. Right. Hair in the armpits and breast development, or hair in the crotch. So that's kind of what we go with. And so you can see that there can be some variation in age there, but that's sort of the distinguishing line. If they don't have that, their child, if they do have that, then we lump them into the adult category. Does that make sense? Okay. More solo child, and then we get into infant, which is 0 to 12 months, and then we have the foreign body airway obstruction skill sheets for 1 year of age and older, and then so it's like they're lumping child and adult together there, and then we'll have infant, which is 0 to 12 months. And then they've also broken it down into this sort of chart on page 54, probably carries on. Nope, just there. That one's kind of nice to look at because it just kind of puts it together and shows the differences here. Now, when you did CPR, you said it was 10 years ago, you think, Adrian? So, about 10 years ago, there was a change. The American Heart Association does the research, and then like Red Cross and everybody else just sort of copies them. And what they found is they shifted to this 30 compressions and 2 breaths, which is probably what most of you are trained on. But the point with that, and it's a little different, so if you look over on the right, so we have 30 compressions and 2 breaths for an adult. And then if you go down, kind of remains that compression 3 and 2 with 1 or 2 rescuers way down the bottom here. So if we go over in the child and infant section, we get down to children and infants, 1 rescuer, same as adult. Children and infants, 2 rescuer, 15 compressions and 2 breaths. Scan down farther, compression to ventilation ratio. Children and infants, 1 rescuer, 30 compressions, 2 breaths. Children and infants, 2 rescuers, 15 and 2. So for everyone in this room, it would be 30 compressions and 2 breaths, then 2 breaths. And the reasoning that I've been told is that they found that getting the blood going with those compressions, it takes some compressions, like 7 or so, to really get it moving. So then if you stop 8 compressions later, then it stops moving. And we're trying to get oxygenated blood to the brain. What I say about adults collapsing, they have oxygenated blood or not?
Less likely to in children.
They're more likely to have oxygenated blood in children because children go into cardiac arrest after respiratory arrest. So they burn up their oxygen and then cardiac arrest. Whereas adults will have a coronary problem. Like kids usually have pretty good hearts, but they choke on something. So they choke on something and then arrest. Whereas adults, they can often have coronary artery disease and so forth. So for the most part, we're doing the 30 and 2 until you end up with 2 rescuers. And then it's on children, we go to 15 and 2.
Wait, what do you do with 2 rescuers? Do you just like take turns doing 15 and 2, or?
Yeah. So remember
And
how.
only for children?
Okay, so on page 54. So page 54, it's a comparison of all of the above. Yeah. And so what we're saying is in the adult column, it remains 30 and 2.
Yeah.
But with 2 rescuer, child and infant, it goes to 15 and 2. Whereas single rescuer, child and infant, you stick with the 30 and 2. I hope that didn't confuse. I was hoping to clarify as opposed to confuse. All right. I'm going to bring in tab over tab.
Care open package and remove bag. Care open package and remove bag. Care open package and remove bag.
Hopefully we can just use this one. So I'm going to try to demonstrate here. How about your head? Some tools that were sent our way have kind of mask here. So this is a bunch of pocket masks here. Well, we have some pocket masks. And it's collapsed, so it can be nice and flat. Sometimes they come in a case, which I think these have. You kind of manipulate it out. And then it's got this kind of little flat tire sort of edge to it, which looks like this one could be inflated a little bit, and it has a little valve. Or not. No, it's not inflating. There might be a hole in here somewhere. It'll probably work as is. And then there's a one-way valve on top, so that you can blow air in, but stuff won't come out and get you. And there's a bit of a filter there. And then there's also another valve here. It's a little bit redundant. Pass that around. And then these guys, it says ready kit. And in there, there's gloves, trauma shears, and a razor. Why a razor? Anybody?
Because you can't put pads on here, so.
Right, so, yeah, carry chest. There's also sometimes a towel. So also, you want to wipe down a wet chest. Oh, remember I mentioned the medical groups? This is bound tree. This one here. Put that together, pass it around. I got one more, I think. Oh, yes, there is. Not the same. It's also one of those barrier devices that we had in our first aid kits. Also trauma shears there. So this one is similar. That first one I was passing around, but it doesn't have the secondary valve. Is that first one that came around? Why, hello.
Just sleeping bags for you.
Oh, yeah? You want us to come on and grab it?
If I can take like 1 or 2 people.
Great. Thanks so much for bringing the other stuff.
Oh yeah, go over this.
I hadn't heard from you, and I was like, oh, look what showed up. And awesome. It took a while to hunt them down.
Yeah. Did you get a trainer at the end? No.
That's what you brought, or
Okay.
who brought it?
Rick.
Oh, Rick.
The other Rick, not this Rick.
Yeah.
There's apparently 3
Yeah.
Ricks involved.
So
in
the
that.
other one was a real
Yeah.
AED, but this one's a trainer.
Okay, awesome.
Yeah, not for use on humans, which is good. No, I was like, I'm not, yeah, I wish I'd be able to talk through it. And thanks for the baby as well.
Thanks.
Cool.
Yeah.
We're good to go.
Do you need anything else?
I don't think so.
Alright.
You good?
Yeah.
Are you able to get some
Yeah.
I think so.
I think so. Nice. Elevating, like, you know. All that good stuff. I got it. Have fun.
Thank you, Rick.
Thank you.
Is it really black and blue?
No,
It's not?
Well, it's good.
How long is the incision?
How long?
Yeah, the big scar.
Like tiny little.
Oh,
like
really?
3 points, yeah.
Oh, laparoscopic. Nice. All right.
It's not that horrible.
Yeah.
It's fun.
Yeah. Okay. All right. Well, thank you. Safe drive. Okay. a whole lot around the whole mask thing and how we're gonna do this. They're basically, these have these plastic things on their faces that become lungs. Yeah, it's, I think we've got enough of that. We only have those 3 masks. We don't wanna share germs too much and all that. I do have some alcohol and wipe things down with, but in any case, I'm gonna take that one, use that. So mouth to mouth was a thing. We don't do it a whole lot, but we talk about it anyway. Lifeguards, I'm sure we talked about mouth to mouth resuscitation, but we try to avoid it nowadays because of various germs folks have. But obviously if it's somebody you know, somebody you're doing mouth to mouth with anyway, you might consider that. But they still, even if you love them, they still might vomit on you. So that's something to think about. But not too much, because you don't have a lot of time. You don't have a lot of time to think. So I'm coming into this space, and this is not going to be very wilderness-minded, okay? It's much more like came to the room and somebody's down, or better yet, still not good, but better yet, you witness them collapse. Okay, so that means you're there right when they need you. So let's go to the original skill section for adults. As they skip a point, they skip something from that whole tabulated bit. They skip the activate emergency response part, which in the wilderness setting is really easy to forget because there isn't anybody to call right then. So I come to the room, and the last one I did is I got my phone out, I dialed 911, and I put it on speaker by myself. So that's a way you can go with it. And I do it myself. Interesting how that's a good voice. Can't dial 911 without that.
Phone?
Oh, yeah.
It's recording you right now.
What's that?
Recording the video right now.
Thank you. Thank you. All right, so I'll just verbalize. Yeah, it's like, what the heck? All right. So I come in, it's like, hey, are you okay? No response. Our usual coming in. Look up, look down, look all around. Why are they there? Do they get electrocuted? There's a stake in here. All right, come in. Same old thing we were doing. Okay, you all right? Look, listen, and feel. And they're not breathing. That's your moment. You activate emergency system. So that call that you have ready to go, or if somebody's with you, say, hey, can you call 911, and then come back and tell me that you did, and they're sending resources. And so then I'm going to breathe for them, but I can also check for pulse at the same time. They don't say to do that, but I can multitask. So then because I'm going to be on their mouth, I'm going to want to pinch their nose. Okay, it's hard to cover both. And how much am I going to blow in there? I go until I just see chest rise. Okay? And then, does it say to check pulse, or does it say just go right to compression?
If there's no pulse, you.
If there's no pulse? Yeah.
Correct.
So if there's no pulse, how long do you check pulse?
Less than 10 seconds.
What's that?
Less than 10 seconds.
No less than 10 minutes.
Oh, it just says less than 10 seconds.
Does it say less than 10?
Yeah.
I would say stay on there for 10. So 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10. So if they have a slow pulse, you want to be able to pick that up. No pulse. Okay, starting compression. So 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 13, 14, 15, 16, 17, 18, 25, 26, 27, 28, 29, 30. Then what?
Breath.
Breath. So just till I get chest rise. And right back to it. I'm putting my hand on the sternum between the nipples, but as I told you before, you want to be up above the notch down here so you're not on the xiphoid process, but not too high because you want the flexibility up and down. Nine 30. And again. Seven 28, 29. What set am I on?
Does that clicking sound, is that part of the thing, or does that mean that you're like doing the correct depth or whatever?
Get to it, man.
It's part of, there's a light on this shoulder, which you probably can't see, but they're green
Oh, yeah.
if you're going deep enough and red if you're not. And then they're also do a different color if you're like going too fast or going too slow.
I'm gonna check the pulse. So I did 5 sets. Okay. The clicking is to indicate that I've gone deep enough. It's just an artifact that they put on here. Okay. And if I don't have a pulse, what do I do? I'll go. Great. Okay. Yeah, I didn't know this would light up, but yeah, there's a light on there. So that single rescuer, hopefully somebody has, you call somebody and they've done it, or you're talking to 911 with your phone, hopefully you have a phone. If not, this is the moment when you go and call. Right? You try to get them going, and oh, sorry, no, it's when you find that they're breathless, and you try to call. But it'd be nice to get some blood going around, and then call. It's bad if you're in a situation where you don't have cell coverage. Now, let's set up and do this so that we can rotate everybody through with this process where you're going to come in, look up, look down, look all around, check on your person, because and we're doing a primary basically. We're coming in, and do we have airway? Do we have breathing? No. We're stuck there, so that's where we're going into that. Do we have pulse? No. We're looking at cardiopulmonary resuscitation. So I think we'll go and do that first, and then we'll come in and complicate it and make it easier in some ways by having somebody else come and help. Okay? I think this is a nice way to set it up. You want them to be on a hard surface. If they're on a bed, you got to drag them off the bed onto the floor, because you need a hard surface. In the hospital, they have pretty hard beds. They put a board in, or roll somebody, put a board in or something. But this isn't too soft, but it's just nicer for your knees. So we can set up the whole 4 adult mannequins like this. And just the same way you're doing everything, getting yourself protected, introducing yourself, and coming into it. Is there any question about the positioning and how I was doing this? For you two who haven't had this before, I'm trying to get the heel of my hand on the sternum. I can see the xiphoid process on this mannequin. I'm staying up above that, like finger width or something. Straight arms, and then my shoulders over them. Here's the thing. If you do bent arms, you won't last as long. You won't do as good compressions. If you're using your butt and your body, those muscles can handle it for longer. You also want to get over so that you are compressing straight down on the sternum instead of off at an angle. Because if you're over here, you're compressing the right lung more so than you are on the heart. You really want that sternum to go down in and flex the ribs evenly, so you get a decent compression on the heart. With the two lights here, it may indicate that if I'm on to one side or the other. I don't know if it was going to do that or not. Some of them were cool that way. See what happens. No.
If you're making that clicking sound, I think it means it's in a great spot.
Yeah, yeah. Some of them just do that. It's just the click. The depth is about 2 inches, which would be what, about 5 centimeters. When we get to the little kid, we'll talk about that more. About 2 inches. What's that?
It's just crazy that it doesn't inherently break the ribs.
I've heard that good CPR will break ribs.
It depends on the person that is doing it, also depends on how flexible the cartilage is on the person. People who typically get heart attacks are older folks, and so they tend to be more brittle, so it's not unusual for them to ribs to fracture. As I said though, that'll make compression easier. The downside could be that you might puncture a lung and stuff like that, but you know, you want them to survive that so they can have to deal with that. You're not trying to puncture a lung, but it's not an issue. You can't kill a dead person. You'd rather have a complaining alive person. Any more questions or clarifications I should do? Let's give it a go. And if you have questions, go ahead and ask them. Let me see if I can get this one rigged up with new lungs and mouth. Adrian, in that bag over there, we've got more of these plastic. There's a heavy plastic. Yeah, that one of the other ones actually. Yeah. I didn't do this yesterday. There we go. Hey, let's stick with the same set of lungs and go to, we'll go to two-person. Just because I'm not sure how many of these I've got, all right? So same rescuer, but the other person will come in. So let me sort of demonstrate what that looks like. Come on over. Work with what we got. I put a new set of lungs in here, and it's not too hard to do, but it's just a matter of number. I've got this bag of them. Yeah, and with the four, what do we have now? What's that? Right. So I come in, and I did my one person. Somebody comes, hey, do you need some help? I said, yes. Would you go and get an AED and call 911 and make sure they're coming? All right, so you call 911 while you're going, and you go and grab the AED. So go ahead and grab the AED. I'm in here doing my compressions and ventilations. So 2 breaths, 2, 4. Okay, so go ahead and open that up.
Care open package and remove pad.
So it's already torn
Care
open.
open package and remove
So
pad.
you want to just easily pull that off of there.
Care open package and remove pad.
Okay, and so there's a diagram of where they
View
go.
one pad from plastic liners.
And so you got one pad.
View one
I like
pad
to have the
from
wires
plastic liner.
up.
Place one pad on bare upper chest.
Yep, that's great.
Place one pad on bare upper chest.
Okay. And then you feel the other one.
Place one pad on
You're doing
bare
this
upper
while
chest.
I'm doing CPR.
View second pad and place on bare lower chest as shown.
Easier to get in. You can
View
be,
second pad and place on bare lower chest.
some of them can be up on the shoulder a little bit. That one's going to be over
Do not
here.
touch patient. Analyzing rhythm.
What I did with this one is I kept the
Shock
plastic stuff
advised.
in.
Charging.
So I did
Stand
there.
clear. Push flashing button to deliver shock.
I'm going to bring this over here. So what I find is
Stand
having
clear.
by the left side of the head is a good way to go.
Stand clear. Push flashing button to deliver shock. Stand clear.
Alright, just want to shut it off for a moment. So a lot of these AEDs will show it, and they're going to have the wire come right across the sternum. It's not great. And so I do this thing where I try to set it up so that the wires are not across the sternum, because I'm going to continue to do CPR here. It will be uncomfortable for my hand, but more concerning is that, you can move to the side just a moment, it might break the wire if I'm compressing there, and then your AED is not going to work. You have to maybe get new pads, and sometimes they'll come with 2 pads. They sometimes come with adult pads and pediatric pads. But this is across the throat. They don't care. They're not responsive. I can still get in and get my pulse here, but now I'm not going to break wires. So that's just a little trick that they don't always have. So this one here, they're showing the wires all going down this way. And that might work as well, but having it all up in this zone is helpful. Okay, so I'm here doing ventilations and so forth, and so, you know, he might not be able to get this pad on until I'm doing breaths. So when I'm doing breaths, he can stick this pad on and so forth. Or if he doesn't know how to do it, when I do finish my compressions, I can do my 2 breaths and then quick stick on the pads. But what's nice about these AEDs, so there's the automated or automated external defibrillators, they give you instructions, annoyingly so, as you can tell. So they kind of tell you what to do, but it kind of, this one is prompting in such a way that's a little bit scary. Here's the non-stick pad that goes between these two, and it was in this package. This particular brand has it so that the wire goes right through it, and so you keep the package kind of there. I've never seen that before. Most of the other ones, the wire's coming out and that it comes free from the package. There's a plug over on the side here. It's kind of like a double phone jack. Some will look different. They'll have different plugs. And then some have a key that will alter the voltage for kids. And then some will have different pads in the way they plug in. It will be different voltage for kids. With kids, frequently they will actually ask you to put one on the front and one on the back. In which case they're kind of in the middle. So you're just zapping them right through. In the ERS, that's what they do with a lot of folks. Anyway, it's just, what you're trying to do is be able to run current through the heart. Okay, so the heart is here, so you're trying to run current through the body and through the heart, which gets back to the towel. Remember I was talking about the towel and wiping them down? We don't want the current to run over the surface of the skin more so than through the body. And then the razor, we want them to stick, so for people who are quite hairy, you might have to try to shave them. Don't get too worried about it. If you don't, you want to shave the hair off, but you might cut them a little bit. But again, hopefully they'll survive and you can complain about it. Some of the razors are just these little, like this one actually, it's like in here, it's like actually has a handle. It's like a regular razor, but some of them are like a little plastic thing you kind of drag across. Some folks where they have a whole bunch of pads, they say stick the pads on to rip the hair off and then get another pair of pads on. It seems like kind of a waste of a fancy thing here. So it'd be good to duct tape so you could rip hair off that way. In any case, so the person comes in with the AED. So now we have two people. If you are a knowledgeable person, then we can get into this swapping out. So you stick with the whole thing and they say, so I'm doing CPR, so Brad, compressions, you got it all set up. He'll start talking.
Tear open package and remove pad. Tear open package and remove pad. Tear open package and remove pad. Use one pad from plastic liner.
I like to do at least the last few numbers that I'm counting to 30 out loud, so that a second rescuer can know that maybe if they're going to do breaths, they're ready to do that. Okay, so then
place one pad on bare upper chest. Place one pad on bare upper chest. Peel second pad, then place on bare lower chest as shown. Peel second pad, then place on bare lower chest as shown.
so don't let it distract you. Okay, so now,
rhythm.
so you say clear, make sure everybody's not touching the patient. Do not analyze the patient, not
Analyzing
us.
rhythm. Shock advised.
Okay,
Charger. Stand clear. Push flashing button to deliver shock. Shock delivered.
so if you are touching
It
the
is now
patient, you might
safe
get
to
shocked.
touch the patient.
Okay.
Start CPR. Give 30 compressions. Then give 2 breaths.
13, 14, 15, 16, really, I was going a bit fast. So I have a metronome on this one.
Give breath.
Some of them have it, some of them don't.
Give breath.
So that'll carry on. There might be times where it will say, shock not advised, continue CPR. And what that means is that the person does not have a rhythm that is responsive to being shocked. So they want you to keep on with the CPR. What it's looking for is ventricular fibrillation, which is this, what's on the EKG looks like sort of a static line. So there's activity there, it's not organized. So we want the shock to be like, hey, get together. And that's what we're trying to have happen. All right, the additional piece of this is that if Sawyer comes in, he gets this all rigged up, we do the shock, he's over here now. He's ready to take over for me because I'm tired. So say I do the final 2 breaths, you're getting positioned. So remember where you want to be. You don't want to be on the xiphoid process, you want to be between the nipple lines. So don't press yet, just look for chest rise. 1 breath, 2 breaths, I'm not going to blow it. But did you all see chest rise when I did it before? So the way these plastic bags are set up, they try to mimic that under the skin. Okay, so go ahead and line up. Heel on the sternum and begin compressions. Excellent. And then head tilt, chin lift, and you blow. 1 breath, 2 breaths. Okay. And then you would continue CPR. Now, a variant of that could be is that he does compressions and I do the breaths. Okay. So say you're finished like 29:30. He's coming in. You're saying 29:30. And I'm ready here. And you're right back at it. So you have to lift off enough so we can see chest rise, but you really don't change your position. You're ready to go. We'll go through the 5 cycles. That's roughly about 2 minutes. And that would get you exhausted enough. And then the machine, usually after 5 cycles, will want to analyze again because it's set up for that. As I was mentioning, we're building up that ATP, which will make the conductivity better for the shock. And then if we do shock, we don't shock, then I can switch in. And maybe he'll do breaths. So the variants we've got, we have these masks. So you should be using the mask. The way the mask fits on here, like the way you think. So on the nose, like so. You still have to do the head tilt and chin lift. And you might get on here and sit up at the top. You can do it with 1 hand, or you can do it with the 2. I think they showed in the book. You're back here, fingers under the jaw. Your thumb's kind of up around the mask, trying to get it to fit down around their face and their big nose or whatever they've got. There are masks for kids and infants, little tiny ones. But if you don't have that, you turn it around and just cover their entire face, so it will cover their eyes and everything. And taking an adult mask, you usually can get it to fit over a whole kid's face if you don't have a kid's mask. Okay. As we did with our throat thing, remember, the way these are set up because of the plastic, the way it folds in there, if you don't have the head tilted far enough back, usually air won't go in, you won't get chest rise. Reposition, try to get that breath in there. Don't spend a lot of time trying to get breaths. Like if you want to try to get it, if you didn't get the first one, get another one. But don't try 5 times. Get that the compressions going and think about what you did and try to do it better the next time. So we need to keep that blood circulating around. You don't want to linger there too long. These are set up such that it works out relatively well. I think I've got to figure out how to reload the lungs pretty well. So we have the 1 AED. So maybe what we should do is have people come and just rotate through this mannequin. A lot of people do the other ones, practice with 2 people, and then we'll rotate using this one here, since we have the 1 AED. That makes sense? All right. I don't know if they'll all light up. It's really cool that one does. Glad you noticed it. Let's see if they do, and see if you can get that click. Be consistent. If they do light up, you want the 2 green lights, as Leah pointed out. Let's go from there. We'll do a few sessions, see if everybody can get. So how are we going to do this whole lung thing? We want to keep the same person blowing breath for a while. And then once everybody's use the lung, and we'll evaluate. I'll count lungs, we'll see if we can make sure everybody gets a chance to blow breath. We'll make it work. We might even be able to use these some way. All right? Let's go ahead, we'll pull the AED off of this one. There are metronome apps you can get on your phone, and they can be metronomes for music or for CPR. And I just like setting mine at like 107. I think they say between 100 and 120 or something, so 107. All right, this is a fresh lung, so what if you can choose to be the breath sounds person? All right, you come into a room, and somebody's down. Just you say that whole thing. Hey, are you okay? Sir, can you hear us?
I hear you.
Hey, hello?
I hear you, Brad.
Are you all right?
Or you guys here?
Oh, yeah.
I just moved away before, it's not, it's still not.
Stop it for a moment. Give you a little more sense. Feel with your hand right here. See how you're getting one light? Yeah. Yep. Okay, ready? No, one light. Two. Keep clicking. Yep, gotta keep going deep enough to click it. There you go. Feel a difference? Yeah. Great. Keep on going. Try to improve while you're pressing. Sometimes only one wrist bends well, so you might have to use the other wrist. Yep. I have that problem. Are you ready? Have you done 30? You ready to breathe? Yeah. Do your breath. I'm gonna try to get it. You got it.
Hi, I'm Son, that's my first experience, can I help you? You hear me?
You got it. Thanks.
That's about how much.
Adjust until you see it. That's it. As soon as you see it, just stop. You don't want to do any more.
You all.
You get to see chest right?
Oh, yeah. You want to mention them?
See if I can get it out.
Yeah. You watching for chest right?
You gotta start this.
You can't. I feel like you're.
That's all you want. That's 30. You want just barely.
Palm is like in the like the palm should be right.
Are you all right with this chest right? Yeah. Great. Just until you see it. I don't want any more. It's very hard to see while you're blowing.
Oh, yeah, no, I was pressing hard, I'm like, I'm not even playing. I think, well, I wonder.
They were fresh. I have really, I didn't want to good slow for this, and we'll watch. I think I got like 30, more than I thought.
Am I supposed to just get
Yes.
Yep.
Alright, come on.
And then we'll tell you to see chest rise. And pitch it. Oh, that was a lot. You gotta be careful how much you get.
Oh, was that too much?
Yeah.
Like whole stomach, like go away, go, that's not a lot of time to do it, like, that's good.
Did some of you have a metronome on your?
This is fighting.
Oh, I mentioned it.
We're not drawing right now, but I have a metronome down. Alright, after this we have an hour.
I just searched it up on.
Because mine is completely useless. I don't think I have one.
It might be. Oh, there we go. Yeah, one light might be just direction. The book says 90.
It's
Check both before or after.
How you doing, sir?
Check before.
Have you done a full 5
That
cycles?
one started at the.
Okay. So then, but you check the pulse at 5 cycles. Awesome. You want to be the one that comes in and help?
Yeah, that's fine.
Great, so grab some gloves and,
That's one.
can I help you? I know some CPR. Hey, can you go grab a naked beat? Did you do that?
You're supposed to do fine.
They were breathless, did you ask? So that's when you want to do no breath breathing.
You've already done this.
Yeah.
I'll do.
It's then.
And it might be asking him to call, but then say, please come back and let me know.
Yeah.
That you called and I said.
Yeah.
No, because you can be ready to give the breath. Pause for a second.
Go ahead.
I'm trying to
Activate.
get lighter breaths. I don't know. I never thought of doing it.
Ask him to bring it in.
Okay, you want to let me try, I think just for.
Why are they all constantly?
So Adrian's got a metronome going, you can hear over there. Got it, that's the speed, got it, you're on it already. Adrian, come on.
I noticed the lights to turn off. The lights is on now.
Alright, I'm sorry. Very good. Yeah.
No, like ready breaths, like getting. That's all I know.
Chair open.
14, 15.
So you're the breather, because you're the one that has
Yes, it is.
From plastic liner.
50.
Peel one pad from plastic liner. Peel one pad. Upper chest. Peel second pad and place on bare lower chest as shown. Peel second pad.
Clear?
Shock advised.
Stay clear.
Charging. Stand clear. Push flashing button to deliver shock. Shock delivered. It is now safe to touch the patient. Start CPR. Compression. Then give 2 breaths. breath.
dotted lines as a guide. And I folded it so it was
Get ready to do.
Check the mouse, check.
Oh, yes.
I mean, the little.
Deep breath. Deep breath.
I know a guy at my neighbor's. Yeah.
That's the pace you want to go at. There you go.
Deep breath. Deep breath.
No, like the face.
Stop CPR. Do not touch patient. Analyzing rhythm. Do not touch patient. Analyzing rhythm.
I've been getting some funny photos from our,
Shock advised.
I don't know.
Charging.
Yesterday we got.
Stand clear. Push flashing buttons to deliver shock. Shock delivered.
Right.
It is now safe to touch the patient. Start CPR.
Let's go ahead and pause
Give
that.
30 compressions.
They're funny.
Go ahead
It's like
and,
we were in the gym yesterday and I was like.
re-stick the pads on. And then, we'll have Max be the first one in. You can, here's the lung.
How'd you guys get the lung in?
So that one side, you don't uncreate, it did, the other side. And, Gloria, you'll be the one who come in with the AED. So let him do a whole cycle.
Are you okay?
Pull that out, and then use these guidelines, fold it up.
We almost had.
So he does a whole cycle.
I love you.
Then when he's checking pulse, he come in and say, hey, you want some help? And so let's go ahead and AED. Got that, man? So that's- Go back and sticking it on around. Next slide.
Where is that?
I don't know if it's similar to a real situation. It's really hard to start on one side.
Where?
Yes.
Oh, okay.
It doesn't look like a lot. But
Usually it has to do with head to-
I mean, I'm surprised they don't like have this much stuff or something so important. I'm surprised they don't teach this. Yeah. Yeah.
Be a bit how I was thinking.
From the get-go, you wanna be the driver?
There you go, you got it.
I don't think we need to be. Have I done questions or?
You guys were practicing?
Yeah, I do it, alright.
Well, and I learned this over the summer, so.
Oh, okay, I learned this like 3 years ago, so. And it's not like I don't speak English, so. Can you hear me?
My colleague Chloe and I have to first aid.
Alright, I don't know how many that was, but. Okay. It's just like. Or we can get a new one.
Oh no, sir, sir, are you okay? Sir, hey, can you call 911? Yeah, call 911.
I'm curious, I'm gonna say I'm curious if you can like.
I guess if the question.
And the reason is that if you push too much, air will get more distance, and you can get air to go into your esophagus and down to your stomach. And then introduce the likelihood that you're gonna vomit. That's not good. So we just until you see that. That's enough pressure. Particularly someone like this big, so like the other people, you're gonna get CPR smaller than you. No, definitely. So that's where you use their chest pressure, not how much you can. Yeah. Great question. Ted, you had.
Sir, sir, yes. Yeah.
Well, I mean, like it's actually, it's my problem.
Okay. You don't want that.
Alright, we're starting the 6 cycle right now.
So maybe it's ready to put you out this one.
Alright, we lost it.
Care open package and remove pad. Care open package and remove pad.
I think it could survive for like, you know, I
Care
think
open package and remove pad.
it might still like.
View one pad from plastic liner. View one pad from plastic liner.
Just go with it.
View one pad from plastic liner. Place one pad on bare upper chest. Place one pad on bare upper chest.
So we need one more.
Place one pad on bare upper chest. View second pad and place on bare lower chest as shown. View second pad and place on bare lower chest as shown. Do not touch patient. Analyzing rhythm. Do not touch patient. Analyzing rhythm. Shot provide. Charging. Stand clear. Push flashing buttons to deliver shot. Shot delivered. It is now safe to touch the patient. Start CPR. Give 30 compressions. Then give 2 breaths.
Is that like where we get one word? No, I mean, that's it is like that, it's like worse because everything you go, oh, but that one.
We're already at 5.
All right, all hands. Okay, so, Simon had a good question, want to make sure you guys hear too. He had heard in the past, you blow in as much air as possible. But Simon's a pretty big guy. If he blew, if he was doing CPR on Julia here, his lung capacity is a bit bigger than yours, so you don't want to do that. So we use the patient's chest rise. We want to just see chest rise. So this is why these are set up the way they are with the plastic bag just under there. So think about relaxed lungs inside the rib cage. If you've inflated enough to actually see a rib cage expand a little bit, that's plenty of pressure. We just want to see chest rise. That's it. Okay. So that was a great question. Did you answer your question? Okay, great. Did you have any questions over here? No. I think a lot of you noticed that you compress faster than the metronome, right? So think about that, trying to get into that rhythm. What was your metronome set at? Do you know? What was yours?
Oh, it was
107. Was it pretty similar to the one on the AED? Yeah, it sounded like it was. Okay, great. So what I'd like you all to rotate and do, which Sawyer and Max have already done, is we'll go right in. You've all done single rescue, and in a way you've kind of done two rescue already, right, just without the AED. So you're in there, single rescuer, and you're, we could even do it so that you're like finishing your compressions, but, and then somebody comes by and say, hey, can you bring an AED? And they bring one in. So we'll go through a lung per person. That'll be fine. I think that'll be fine. All right.
Oh,
you can,
we can probably reuse the ones that we can use them too.
Well, you can reuse the one that you use. Yeah. We can also bring your mannequin over and use it. If you have one ready to go that somebody was using, we can do that. Yeah, I just, I'll have to, when we're done, I'll tell Rick, hey, you need to order more of these bags. So yeah, why don't you could stay in your own teams if you want, and just rotate through, or in pairs. So if you had 3 people that came in, as you do here, you could have an AED, a compressor, and a breather. Okay, and now we have 3 people who can rotate through compression, because that's the tiring part. And you can move quicker through the breathing. So then the gap between your compressions is less, because you're already there, you're hovering. You're looking for the chest rise while the breather. I find that these are challenging to see the chest rise while you're doing the breathing. But as soon as that breath is done, like you can help the person exhale with a compression. To give you a sense of this, what they call high performance CPR, which is kind of the next level, it's not really here, they never stop compressions. They actually just breathe between. They do it every, like rescue breaths, like every 5 seconds. They'll just try to get a breath in between compressions as they're going. It's kind of insane. It's wild to watch. But we're not going to do that. But I'm just trying to give you a sense that those compressions are important. So the breathing pause needs to happen, particularly if you're by yourself, but you can reduce it if you have somebody breathing and someone else compressing. Does that make sense? So, breath, breath, compress, compress, compress. This AED is also quite slow, in the sense that they'll say, shock advised, shock delivered, and there's like this pause, and then continue CPR. As soon as the shock's delivered, you can get right in there, but it'll mess with your metronome time and all that. But there's nothing happening. It's not like they're fully, like they're charged and they're going to get a shock. It's immediate, it's over, and you can get going. But for the sake of sanity, going with the machine, just follow the directions. I just wanted to let you know, in terms of the function of us trying to pump blood and breathe for somebody, you want to keep those compressions going as much as possible, and not have a long gap. All right. probably in pairs is probably just the way, like these guys did, it probably makes the most sense, right? Because you have a compressor breather, somebody comes in with the AED, while you're doing compressions and breathing, they slap it on there. When the machine says, stay clear of the patient, analyzing, you're clear. It seems like it wants to give a shock every single time, which is great. As soon as it's done, you can carry on some compressions and then switch it up so you have someone else as the primary and then somebody coming in. All right? You organize yourselves around it. Let's bust it out. And you're all good at compression, so let's just move through this so you have some practice with it. AEDs vary a little bit, but not a ton. You just follow the direction.
But also, especially like sports like sports seem difficult. I can do compression based on all the people.
You're bringing your own mannequin? All right.
That's fine.
No, I think we should.
We're bringing our own.
Oh, they're coming. Oh, man.
So I'm gonna just stuff this in here. And roughly the way it would be set up.
Holding some
Chair
chicken
open
lungs.
package and remove
I'm gonna let you hold on to that, because that was fun.
Chair open package and remove pad. Chair open package.
Are you okay? Are you okay? Can you hear me? First stop breathing, we need to call 911.
Middlebury College, ADK house, John Calogero.
Unresponsive patient.
I'm performing CPR.
Oh.
Yeah, green light this.
Chair open package and remove pad.
Oh, so there's one pad that you don't want to peel
Chair
off.
open package and remove pad.
You okay to work around it?
Chair open package and remove pad. Peel one pad from plastic liner. Peel one pad from plastic liner. Peel one pad from plastic liner. Place one pad on bare upper chest. Place one pad on bare upper chest. Place one pad on bare upper chest. Peel second pad and place on bare lower chest as shown.
Maybe just press the shock button.
Peel second pad and place on bare lower chest as shown. Do not touch patient. Analyzing rhythm. Do not touch patient. Analyzing rhythm. Shock advised. Charging. Stand clear. Push flashing buttons to shock deliver. You are now safe to touch the patient. Start CPR. Give 30 compressions. Then give 2 breaths.
But this is like relatively close to the average. It feels like nothing. Like it feels like exhaling absolutely nothing.
Give breath. Give breath.
Maybe calibrated to get you not to
Oh yeah.
Oh, is this the press ready? And then wait, can I press this? Okay, I got it. Go ahead, Okay.
Hey, everybody,
Do you want me to face?
let's pause a moment. Because I want to get you through the baby, and then while people are doing AED, you can also also be practicing with the baby, okay? Did you need to switch on now?
Yes, but we can do that after.
Okay. All right. Let's go through a few things that we can do while it's done, because this is a little bit of our roadblock here. Oh, look, you have a safety vest.
Oh, I do, yeah.
Awesome.
Why?
Is that for like running in the dark?
No, I actually gave it to my friend for a party, and then she just gave it to me today. Back.
To give it back?
Yeah.
What was the theme?
Neon.
Neon, oh, okay. What if you has like reflective pants? It's like right in here. Is that you? Oh, it's like right here, yeah. They shine even in the light. So let's talk about the adult here for a moment. So we have a variety of skills here. One is around choking too, right? So I think with this as our hold up here, I want you all to have some of that practice. So with adult and choking, that's in the latter pages here. Adult and child skill sheet. Foreign body airway obstruction. FBAO. Sorry, we did a class and then we were at a bar afterwards and we decided to create a drink called foreign body airway obstruction. It had an olive in it.
Was it good?
Yeah, it's terrible. It was like whiskey and Tabasco sauce and an olive and the Tabasco sauce settled at the bottom. So you drank it, it just burned so bad. Anyway. We're being silly. All right. What's the sign of choking? Yeah, that's the universal sign of choking, right? And what's an actual sign that you observe of somebody who's choking?
Can't speak.
What?
Can't speak.
Can't speak. Can't make any noise, right? What about coughing? Not choking. What about saying, I'm choking? Not choking, right. Because airway's passing. Now, they might have something stuck in partway there. It's a partial airway obstruction, but not a full one. So if they're choking, if they're coughing, encourage them to cough. I wouldn't slap them in the back, but encourage them to cough so that they maybe will expel the thing. And what else could help remove an object stuck, usually in the vocal cords, in the larynx? Getting your head low, right? So sitting down, putting your head between your legs. Use gravity to advantage, right? So coughing and getting the head down like this, so it will fall out this way, as opposed to gravity continually trying to keep it down in there. All right. This is a classic situation. Unfortunately, people are embarrassed to cough. We're at a restaurant, somebody's choking, they get up and go to the restroom. They're by themselves in the restroom. They run out of air because they block their airway and they pass out in the restroom. Unless somebody is there to witness it, they might die right there. And respiratory arrest is going to lead to cardiac arrest, and then you have that problem, compounded problem. So, if you get that knowledge out into your family early, say, hey, if you're choking, don't leave the table, don't go to the bathroom by yourself. Somebody go with them. Or if you see somebody kind of quietly get up and go, just like catch up with them and say, hey, are you okay? So that sadly happens fairly often because people are embarrassed. I have this, people fall overboard in these boats and they won't make a sound. And it's like, oh, I'm embarrassed. And they fell in the water. It's like, you're floating away now. Say something so we know. But it's one of those things. So position ourselves for abdominal thrust. So with an adult, and they're gonna show this some different ways, but what I do is bring your fist in here and put your index finger into the belly button. You get your other hand in there, but rotate that index finger fist, make a fist and just rotate up. That kind of gives you a location of where to go, okay? And then the other fist is on top of that, and you're going to try to drive the first fist up into their abdomen to do what? Well, Heimlich was the one who came up with it. But we're trying to push against that diaphragm, therefore push against the lungs to create positive pressure to pop this thing out, okay? We always have some air in our lungs, and so we're trying to use that to expel it out. So the position for this, for somebody who is conscious, responsive, standing up, is behind them, one foot between their legs, your other foot back. Is he bigger than me? Yeah, he is, right? And so I'm going to come over here and guess about where his belly button is.
I got my notepad here.
There's your chest. Let's say it's about there. Like pretty close.
A little high, yeah.
I'm high.
You're a little low.
I'm a little low. Somewhere in there. Right, I'm going to be compressing on your notepad. But I get behind him, and so I'm in a sort of an athletic stance. Why am I doing this?
Casey passes out.
Casey passes out, so I can not get knocked down myself, and I can then lower it to the ground. So then I'm going to do these 5 thrusts. And see if and actually I'm just going to keep on thrusting until it comes out. If it doesn't come out, he's going to pass out. He's going to slump to the floor. And then I'm going to then do what?
Lowering slowly.
I'm going to then do chest compressions. Okay, so that's where it's similar to what we've been doing. Okay.
Is there any point where you're gonna hit them on the back, or is that not?
No. Not with adults, with babies.
I was in like a, I don't know, lunch place and someone started choking and they lifted them upside down.
Wow. They did or you did?
They did, not me.
Was it a kid?
Yeah.
Can we try that?
Sure. Well, basically with babies, we'll get to that. I mean, gravity, did it work?
Yeah,
That's awesome.
but that was after they like tried to like get like do the whatever, yeah, Heimlich first.
Right. So if you notice in the book here, it shows that we're doing this for anyone older than a year. We're trying these abdominal thrusts. It can be kind of challenging on a little person. And you see like the person there down, squatting down to get to the right position with somebody. That's too small. Okay.
Hold them when they pass out.
What's that?
At least you're.
Oh, yeah, they won't. Yeah, they won't hurt you. On the second page, on page 51, it says, repeat thrust until the altitude is swelled until the patient becomes unconscious. If each thrust has a separate and distinct movement to dislodge the obstruction. Sometimes it's dramatic and just flying out across the room. It would be great. Sometimes it just comes out a bit and then they can breathe a little bit. Maybe they can go in there and pull the long piece of steak out or whatever it might be. But there is this little piece on 51 says, obese and pregnant perform chest compressions instead of abdominal thrusts. Okay. If the patient becomes unresponsive, activate the emergency response system. Okay, so we're back to that breathless person, just like your one here. If they don't have a breath, call 911. Okay, so they don't have a breath and they're now passed out, they're unresponsive, call 911. And then begin CPR, 30 compressions and 2 breaths. All right, this may sound a little bit counterproductive that we're blowing in where there's something obstructing in there. But what we're hoping is that by being unresponsive, they may relax their larynx and it may loosen that. We're hoping that our chest compressions drive it up. And we'll take a look in there, okay? So, lower the patient to the ground, begin chest compressions. Each time you go to give ventilation, open the patient's mouth and look inside for obstructing object. If the object is visible, remove if possible. Years ago, they used to say this blind finger sweep, and they stopped us from doing that because there was a chance we were going to push the object in. So this is more of a visible look, and then grabbing if it's there. Okay, and then otherwise than that, it's the same sort of similar chest compressions to CPR. The other thing is it might dislodge but still be down in there, but maybe we can get air past it with our breaths and actually help them oxygenate their blood and then continue our CPR. Okay, so that's kind of the sequence there. Standing up, we try to give the abdominal thrust. We just keep on giving them until it comes out or until they go unresponsive. We lower them to the ground. We move to chest compressions, but in the same sort of sequence as with CPR 30 and 2, but instead of just giving breath, we look first. Sound good? So that's something you can all practice over here. You're not going to give hard abdominal thrust to a real person, please. But the lowering the person to the ground would be good, something to practice. It can be challenging, so be careful about that. But that's leg behind, bent knees. You're already around them, so their arms should be draped over yours, so you have them caught that way. And slide them down and lower them to the ground. Questions about that? Good. All right. And then we have the little guy. So with kids, it's the same. With these guys, we've got, so airway obstruction is the likely cause. I guess this kid, he wasn't a baby, he was 4 years old or something. He did a bunch of things. This kid, pulled this kid out of the surf, and then somewhere totally different. I helped him cough out a candy wrapper. He was like, he put like a Werther's or something like that, and was like sucking it out of the wrapper, sucked the wrapper in. It's a little scary. That's partly why balloons are like out, because they're flexible. And if they get caught in there, when you're blowing and so forth, they're coughing, it's just stretching, and it's not a hard object that can shoot out very easily. All right, with babies, much more likely that, and children too, much more likely that they've run out of air for a cardiac arrest. So choking is much more like choking, drowning, crawling around pools and stuff like that. Foreign body airway obstruction with kids, I want to just double check and make sure that that's correct. Yep. Okay. So with kids, or with babies, you have this thing. So if they're coughing, yes, this is where we do the 5 back blows. They have these giant heads, so we got to support their heads. If their neck flops like this, it can really do some damage. You really don't want floppy heads, and I guess any of you picked up babies like, support the head, support the head. You get that, right? It's always this whole big deal whether the baby can actually support their own head, right? There's that piece, but it's still this giant body relative to the rest of their body. So the 5 back blows, again, you can get them down. They might even show it like where the person has them on their knee. You get them on their shoulder, and I've got face like so. 1, 2, 3, 4, 5. I'm kind of hitting this kid right between the shoulders and the shoulder blades. And, try not to hurt them, but I'm also really they're going to die if I don't get this out. So then I do the same sort of thing. I flop, I sandwich with my arms, and I go like this, and I still have them down. And then I give chest compressions. 1/3 the depth of their chest between the nipples. 1, 2, 3, 4, 5. Looking in there, flip. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Okay? So back and forth until we get this out. We just keep on doing that because we're basically doing the compressions here. Let's just see here if they talk about getting air in. Yes. then we move into the rescue breath, or sorry, the compressions and breaths. So if they go unresponsive, so, you know, if the kid's thrashing around, and if they go to the point where they're not thrashing around, then we can go into compressions and breaths. Okay, so special considerations for doing that with kids. At this point, we want to get them onto a hard surface. But because of that giant head shape and so forth, we can't just lay them flat or they would compress, they would flex forward. Okay, so we want a book or something about 3/4 of an inch under their torso so that their head can be back a little bit. Okay? And then we get into those compressions. The other thing you can do besides that, though, is you can go circumferentially, like so. You can reach around the kids, so they're small enough. You can do chest compressions with your thumbs. So 1, 2, 3, 4, 5, 6. But I want to support them, so I shouldn't have them flopping like that. So I should still be down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now when I go to give breaths, I can put my mouth over their nose and mouth at the same time instead of pinching the nose. It is critical that you look for chest rise doing this, because you all have much bigger lung capacity than the kid. They recommend filling your cheeks with air and just a little puff and look for that chest rise. I'm going to blow into this little kid. But I'll do this so you all can see. You see the chest pop up a little bit? So you really got to be careful with them. You can pop their lungs. That's why this practice throughout, whatever person, you're just looking for evidence of chest rise, but critical with the babies. And I'm looking for this object, right, before I do that. And then back to compressions. I can do it with my hands, like so. So I'm using fingers, like 2 fingers, or my thumbs with babies. With kids, you can do one hand, and you're compressing less, more like an inch, inch and a half. I don't think there was anything other than that. Obviously, we're going to keep on going until we get this thing out. If this was an arrest, not a choking situation, you came in and they said, my baby's not breathing, and so forth, we might have them, they're already unresponsive, we're just going to go into CPR. The difference with the kid and the baby, if we get a second rescuer in, then we're going to do 50 compressions and 2 breaths. Okay? We're really trying to move things along, get air into them. It's easier to get the blood flowing in the little heart, moving the little heart. That's my thought. Okay, so in that case, so say Adrian comes on over, I'm doing, here he comes, he's coming over, I've got 1, 2, 3, 4, hi Adrian. 9, 10, 11, 12, 13, 14, 15. There you are. There you go. See how we can be faster with those 2, like you were doing with the adults. Okay? I've got a little spray bottle with some alcohol if people want to do that. And we don't have a bunch of baby lungs. So I don't know what you want to do that. You can also just pretend, hey baby. Hey baby. It's kind of fun to see the chest rise. Okay, so we'll have our AED station. So 1 person to 2 person CPR with AED. We'll have our choking to sort of CPR choking adult, and then we'll have our baby, 1 person to 2 person, well, choking, and then 1 person to 2 person CPR over here as well. Just so you bring the book with it. Okay? Yes? You're all okay? You need a break? You want a break? You're moving.
Yeah.
Looking for signs of life. Baby, baby. All out. Alcohol? That's where that happened. It wasn't through that. It's my alcohol. Somehow I picked it up.
I think it's funny, by the way, you're taking a video of me out of the bottom of the face.
Oh, you like that?
I think it's a nice touch for everyone watching the video.
It's a prop. It's an important prop.
Chair open package and remove pad. Chair open package and remove pad.
When you feel it, don't.
Chair open package and remove pad. Peel 1 pad from plastic liner. Peel 1 pad from plastic liner. Peel 1 pad from plastic liner. Place 1 pad on bare upper chest.
Yeah, but if you are
Place 1 pad on bare upper chest.
the chest, you're just going like this.
Place 1 pad on bare upper chest. Peel 2nd pad and place on bare lower chest as shown.
Yeah, I think that's.
Peel 2nd pad and place on bare lower chest as shown. Do not touch patient. Analyzing rhythm. Do not touch patient. Analyzing rhythm. Shots advised. Charging.
Yeah, for, do you start with the.
Stand clear. Push flashing buttons to deliver shots delivered. It is now safe to touch the patient. Start CPR. Give 30 compressions. Then give 2 breaths.
When he was choking, fell down. Well, he was already up.
Give breath.
So how do
Give breath.
Someone's head from like walking back.
So you have one leg between.
I wrote Bailey things.
You have one leg between, so they're here.
Liz, do you feel like you?
They're on one side. They're hitting over.
That's what I said, I can literally keep the pads on and that like,
Let's see what they do.
I don't feel like doing those stuff. But if you want to practice something or something,
So
then
just let
Give
her
breath.
practice.
Oh, yeah. Stay there. Stay there.
Please don't be over.
It's almost like the AED nightmare. It's gonna haunt her.
Chair open package and remove pad. Chair open package and remove pad.
That brownie was really
Stay on.
Yeah, that was safe now.
Package and remove pad.
I was eating while he was.
Peel 1 pad from plastic liner. Peel 1 pad from plastic liner.
Move your AED to your left.
Peel 1 pad from
Oh.
plastic liner. Place 1 pad on bare upper chest. Place 1 pad on bare upper chest.
down a piece of steak in the leg.
Place 1 pad on bare upper chest. Peel 2nd pad and place on bare lower chest as shown. very low
This has to
chest
go
as
through the
shown.
sequence.
Do not touch patient.
This one's actually,
Analyzing rhythm.
this one's actually like, it's
Do
like
not
bypass.
touch patient.
It's like
Analyzing
bypass
rhythm.
button where it's like, oh, you add that pressure.
Advise.
Did you like?
Stand clear. Push flashing buttons to deliver shock. Shock delivered. It is now safe to touch the patient. Start CPR. Give 30 compressions. Then give 2 breaths.
Like, what if I like just elbows on the ground, you know?
If we got lungs laying around, let's go ahead and put it in here. Is this a used lung? Is that a used lung?
Yeah, this one's a good one, but then
You're gonna
you
use
can play with, yeah.
Yeah. An ornament?
Yeah.
Someone else can use the AT.
Oh.
Thank you. Let me know if you need any instruction in any of the zones here. You guys, you know what you need to do? You're starting with a single rescuer and then somebody comes in. Oh, yeah, it looks like, here, this one's ready to go, I'll load that one. So save some time, we wanna do other things. Is this right? I'm sorry,
I've used these already.
Oh, okay. Are you with this group?
No,
Oh, yes, okay. You wanna load that in?
Me and Holly.
Yeah.
Give him your line.
Oh, for that one?
This one's that one.
Okay,
Much nicer handoff. You guys are complicated.
Thought about it, just saying it.
But impulse restraint is a sign of maturity. Remember when Michael Jackson held the radio over his mouth?
Hello, are you okay?
I saw a video the other day.
Jerry Garcia.
It pertains to a conversation that we had.
Was it medical related?
Not in the slightest.
Oh, yeah. I might go top.
But it's awesome.
I'm gonna hover over here and monitor the seat.
I don't know, this is close.
This was a video.
Hey, are you okay? What's going on here?
I'm about to do CPR. Can you call 911 and bring me the AED? I'm an AED. Anyway, I was inspired.
Send it.
I want to give it a go.
That's what that is. Send it.
Care
You can do
open
that.
package and remove
And send that to me.
Oh, no, no, no.
Care open package and remove pad. Care open package and remove pad. Peel 1 pad from plastic liner.
The other ones don't peel off because
Peel
it's
1
serious.
pad from plastic liner. Peel 1 pad from plastic
Did I set up
liner.
a flicker? What
Place
do you
1
think?
pad on bare upper chest.
I'm saying if you want me to share a picture.
Place 1 pad on
Is
bare
that
upper
too old
chest.
school?
Place 1 pad on bare upper chest. Peel 2nd pad and place on bare lower chest as shown.
Let's go a little bit lower to the side. You want to
Peel
basically
2nd
almost
pad and place on bare lower chest as shown.
This one should be a little
Do
higher.
not touch patient. Analyzing rhythm. Do not touch patient. Analyzing rhythm. Shock advised. Charging. Stand clear. Push flashing buttons to shock delivered. It is now safe to touch the patient. Start CPR. Give 30 compressions. Then give 2 breaths.
circumference of the book.
Give breath. Give breath.
Good work.
Give breath. Give breath.
I guess I'm probably pulling back to like directionally so that get that. I guess do it
Give breath. Give breath.
So with the counting, if you do like 28, 29, 30, you could actually be right there.
Ideally, you would have a bunch of portable
Give breath.
Yeah.
Give breath. Stop
Pressure
CPR.
to count, so you know where it's at.
Do not touch patient. Analyzing rhythm. Do not touch patient. Analyzing rhythm. Shock advised. Charging. Stand clear. Push flashing button. Shock delivered. It is now safe to touch the patient. Start CPR. Give 30 compressions. Then give 2 breaths.
You can't do it while it's on. Why is my phone?
That's why you're supposed to have like
But it's getting on the
okay, here's something. I think, so review whatever you just tags and outwards, that's like
Not the actual spelling. And then the email and everything else. I'm gonna link.
Do 2 breaths.
Yeah.
5 and 5
Anyways,
back.
I start.
Let me go in response. If they're still responsive, just keep with it. When you do the flash.
I would definitely, if nothing else, even if I just loaded that way, maybe my last step would be.
Oh my goodness.
Oh, I can do it, well.
Because you don't know.
Tell me how to do it.
I'll do the AAC and then we can do it on 10.
Look, are you there? Can you hear me?
Hi, what's going on? Can I help?
This is, she's, no breath, no pulse.
How can I help?
Probably won't get AV.
Tear open package and remove pad. Tear open package and remove pad. Tear open package and remove pad. Peel 1 pad from plastic liner. Peel 1 pad from plastic liner. Peel 1 pad from plastic liner. Place 1 pad on bare upper chest. Place 1 pad on bare upper chest. Place 1 pad on bare upper chest. Peel 2nd pad and place on bare lower chest as shown. Peel 2nd pad and place on bare lower chest as shown. Do not touch patient. Analyzing rhythm. Give breath. Give breath. Give breath. Give breath. Stop CPR. Do not touch patient. Analyzing rhythm. Do not touch patient. Analyzing rhythm. Shock advised. Charging. Stand clear.
Clear.
Flashing button to deliver shock delivered. It is now safe to touch the patient. Start CPR. Give 30 compressions. Then give 2 breaths.
Alright, we have one more group, is that to do
I
this?
think
or-
I'm AJ for unless you guys
Change out some lungs.
Care open package and remove.
What's the name of this guy? The AD voice.
It's like what they use on LA Metro. They include now shopping and hair tax.
Metro Mike.
Yeah, Metro Mike.
That's it.
I'm gonna give you lunch.
You okay? You okay?
Can you hear me?
Hey, Jamie, can you help? What's going on?
Yeah, if you could get the aging color one, that'd be great.
What's going on? How'd you find this?
I'm gonna send the password for it.
You need somebody to be a second.
No,
Care open package and remove pad. Care open package and remove pad. Care open package and remove pad. Peel 1 pad from plastic liner. Peel 1 pad from plastic liner. Peel 1 pad from plastic liner. Place 1 pad on bare upper chest. Place 1 pad on bare upper chest. Place 1 pad on bare upper chest. Peel 2nd pad and place on bare middle chest. Peel 2nd pad and place on bare lower chest as shown. Do not touch patient. Analyzing rhythm.
Say it to its head.
Do not touch patient. Analyzing rhythm. Shock advised. Charging. Stand clear.
Clear.
Push flashing. Shock delivered. It is now safe to touch the patient. Start CPR. Give 30 compressions. Then give 2 breaths. Give breath. Give breath. Stop CPR. Do not touch patient. Analyzing rhythm. Do not touch patient. Analyzing rhythm. Shock advised. Charging. Stand clear. Push flashing button to deliver shock.
Clear.
Shock delivered. It is now safe to touch the patient. Start CPR. Give 30 compressions. Then give 2 breaths.
Get with the times. Come on, gotta move along.
Give breath. Give breath.
Yeah, you finished it, right? I mean, what?
You wanna get me going there, Dan?
Sure. Well, like, it's not, I mean, I kind of
It's
thought
not
to
too
do it.
much.
We're impressed.
Okay, or I think it's 7 minutes.
Is that a long?
Yeah.
Give
I
breath.
didn't load a mannequin.
Give breath.
So you have one ready to go. Everyone else done everything? Babies, AED?
Yes, I went.
I mean, when you don't have a mask, it's like just using a handkerchief or something standard.
Yeah.
So which one of you both need to be the rescue vest?
We've done everything except for the AED.
Yeah.
Right, okay.
They-
So one of you's gonna be the primary and do breath, and then that's what it comes with the AED, we'll swap, so we'll load, we'll reload, and we can swap, so you both can do that. You hold a second?
Yes.
Or we just let it go with the same color earlier.
If you want to, you can. So if that's his one, this is yours. So, some tips while we're talking about this. So, remember with the babies on the hard surface, you need a book or get your hands behind them to do circumflexion. They'll flex too much, you will hurt them and or you won't be able to get air into them. Just cheek puffs, very small, just till you have chest rise, very little air. Just till chest rise with everyone else. The little ready kits here have trauma shears in them. You need to expose the chest. You don't want to do compression over buttons or anything else. Bras, you don't want underwire bras that cause burning. You want to get that off and be right down on bare chest. As we were talking about wiping down the patient if they're wet. If they're in a puddle, it'd be nice to drag them out of the puddle so you're not kneeling in water. You don't have that issue. If you're kneeling in water, you deliver a shock. There is a chance you would feel the shock. They're conducting through the patient, so get him out of water. Dampness apparently is not a big deal, but like water, not ideal. So. Oh,
I guess.
if you are a little bit like, you forget what to do, and you are in a zone where you can call 911, most 911 dispatchers are trained to coach this over the phone and have done so successfully, which is pretty cool. Like somebody's never done CPR and they talk them through it until like EMS arrives or something like that. That's pretty neat. Same with Heimlich and foreign body airway obstruction. What else? In this front page here, they do talk about, when page 44, I'm just going to read it through because so they have on the side here, assess, check for responsiveness, check for breathing, shout, are you okay? If no response, apply painful stimuli, check for no breathing or normal breathing. So remember, we're doing the LLF, look, listen, and feel, see if they're breathing. But they're saying to, try to wake them up like we were doing with the others. I think getting in there and finding if they're breathing is good. 2, activate emergency response system. You can use your cell phone to call for help. Shout for help, direct someone to call for help, activate the emergency response system, and get an AED defibrillator if available. 3, check for pulse, check carotid pulse for less than 10 seconds, they say, as you said. If there is a pulse but no breath sounds, ventilate the patient once every 6 seconds or 10 breaths per minute. So we're talking about rescue breathing. I know there are very circumstances in which somebody will have a respiratory arrest and not cardiac arrest. Sometimes with electrical shock, they can end up with that. Maybe they've just crumpled over. You need to then breathe for them. Spontaneous breathing sometimes will come back after a bit. If not, if there is no pulse, then you're going to do the full-on CPR. Okay. Check for correct hand placement. So again, we're trying not to be down on the xiphoid process. This person with smaller breasts between the nipples is about what we're after. But you don't want to be too low, you don't want to be too high. Again, with this size person, actually, this one you can see the xiphoid, that little bump right there. So the notch, if we want to be above the notch. As I said, in the old days, we were trained to be two fingers above the notch. As long as you're not down on that xiphoid process, or not too high where you don't have the flexibility of the chest. I think Leah brought this up earlier with the baby. Allow for complete chest recoil. Make sure it comes all the way up so that you're getting a full compression and you're not holding the chest, not allowing it to come up. So thank you with that, Leah. It's a good reminder. And minimize interruptions. So trying to make sure you get that full 30, get your 2 breaths in, get right back on it. That's why 2-person is better, because you can get right to it quicker. As you have all seen with this particular AED, I think it's slower than average. Some of the others are better. That time after the shock, it's really not any excuse. Like now, it's safe to touch the patient. You can continue CPR, and then the metronome gets going. That's a long wait. If no AED is available, continue CPR for 5 cycles of 30 and 2, stopping every 5 cycles to check the pulse. And you continue on. So you get relieved. So front country, you don't stop. If you get some other people in, you can get them to compress when you're exhausted. That's why on our island, when there's a cardiac call, they often will call out our fire department as well, because EMTs and paramedics as a pair, they're not enough. So they need more people. So we'll try to get all the firefighters are also trained at that. In most cities, firefighters are at least EMTs. Some places they probably will be paramedics too. So you need lots of people. Again, your chance of success with this person is best if it's witnessed, so there's no really very little delay from collapse to getting somebody on there and compressing. And in places where there are these AEDs and you get quick response, outcomes are much better than some other places, but sometimes not. Sometimes there are people who have had many heart attacks and they've done some damage, so it's not all on you for sure. You're just giving it a second chance, maybe. All right, I know you still have a little bit to go, right? Just wanted to engage everybody else who's otherwise done. Feel free to look through those pages a little bit more, see if you have any questions. You're all doing great. Appreciate your attention on this. We're done with these others who might strip the lungs out of them. They are. Yeah, it looks like they are. We can bring it back over here. What's that? Yes, it is.
I think,
So I did AED first.
I've got my one. Oh, you just said it too, actually. So I'm on about
I
one.
did first. The AED. Can't figure it out.
Yeah.
So you put the pads on and then.
Orange one.
Press it down, let it roll.
It says
for like wilderness sites to not do CPR if they're hypothermic? What's the reason behind that?
I think it'll tell
Yeah,
us.
but let's question.
Okay,
Like,
well,
you'll,
let's,
like,
let's bring up the.
Yeah, like, no, like you're gonna run into it and you're gonna be like, oh,
Cause I feel like.
that's like, you know, it wouldn't be plugged in, you use CPR, like check the code through it.
Well, that.
So enter C, hello, next time this plan, you've got some personal experience, can help you out.
Yeah.
You there, you ready to see what's going on?
No breathing, no pulse.
You get me every 80.
Your body.
And I think you start CPR.
Basically.
Tear open package and remove bag.
Really?
Tear open
I have
package
an
and
answer for
remove bag. Tear open package and remove bag. Peel one pad from plastic liner.
One of them stated.
Peel one pad from plastic liner. Peel one pad from plastic liner. Place one pad on bare upper chest. Place one pad on bare upper chest. Place one pad on bare upper chest. Peel second pad and place on bare lower chest as shown.
Eventually figures it out.
Peel second pad and place on bare lower chest as shown. Do not touch patient. Analyzing rhythm.
So you say clear.
Do not touch patient. Analyzing rhythm. Shock advised. Charging. Stand clear. Push flashing button to deliver shock. Shock delivered. It is now safe to touch the patient. Start CPR. Give 30 compressions. Then give 2 breaths.
What's your time is? It's so freaking slow.
Well, there's a timer, we're 120 right now. I think it's supposed to be repeated.
Give breath. 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 Give breath.
Less.
Give breath. Give breath.
So, with the
Stop
breath,
CPR.
don't pump it in there
Do
real
not
fast.
touch
It's
patient.
not a.
Analyzing rhythm. Do not touch patient. Analyze.
Eventually it would.
Oh, really?
Yeah. I'm gonna try to time the chatter. Comes through. Long delay. So you're done, right?
I not set up anything, so we're just gonna switch.
Right, but you're done with your lung.
Yeah. I'm doing mine. I've got it right here.
Oh, awesome.
Trash is over here. Keeping it. Souvenir.
It's a memento, yeah.
Little spit in a plastic bag.
Never.
Pour it out.
Don't worry, I brought my own.
Alright, ready? Hello, I'm Helena. This time we have some first aid experience. Are you okay? Can you hear me? Yes, sir.
Care open package and remove bag. Care open package and remove bag. Care open package and remove bag. Peel one pad from plastic liner. Peel one pad from plastic liner. Peel one pad from plastic liner. Place one pad on bare upper chest. Place one pad on bare upper chest. Place one pad on bare upper chest. Peel second pad and place on bare lower chest as shown. Peel second pad and place on bare lower chest as shown. Do not touch patient. Analyzing rhythm.
Clear.
Do not touch patient. Analyzing rhythm. Shock advised. Charging. Stand clear. Push flashing button to deliver shock.
Clear.
Shock delivered. It is now safe to touch the patient. Start CPR. Give 30 compressions. Then give 2 breaths.
9 seconds.
Is that all?
Yeah, from after the shock, 9 seconds until the metronome starts.
And the rule is you should never have them like without CPR for more than 10 seconds, right? That's my understanding. Like, 9 seconds feels like it's
2 breaths, and then you go.
Give breath. Give breath.
Also, the metronome is the worst part in my mind because it's wrong. Like if you go by the exact time of the metronome, the lights start, like pacing.
Oh, it's too slow.
It's too slow. Metronome.
Oh, it is.
Yeah.
Wait, this may be a little.
Give breath. Give breath.
I think they just got it.
Yeah, I got it.
Big baby.
Give breath. Give breath. Give breath. Give breath. Give breath. Give breath.
Just waiting for you.
Stop CPR.
There you go.
Do not touch patient. Analyzing rhythm.
Shock a little bit.
Do not touch patient. Analyzing rhythm. Shock advised. Charging. Stand clear. Push flashing button to deliver shock. Shock delivered. It is now safe to touch the
It's
patient.
now safe to shut off the.
Start CPR. Give
saved a life.
Oh, I like.
Alright, now I'm on the hunt for the coolest AED one. This is not cooler than this one.
I find mine is a low bar.
It is a low bar.
Yeah.
I've been over in.
What is the,
Pull along. We did it. It goes like this. It should all stack together.
Actually, that's all I know.
Head to head, head to head.
I think we're ready to get
I just will get the lines from there.
Is baby coming out of the blue bag?
Baby's in its own little group, yeah. Still, they were an
It was down, it was when I
Yeah.
first started to take my skis off with my ski on, and I used the puller.
Oh, man.
Well done, everyone, well done. In large part, thank you for your patience. A lot of waiting around. Yes, so. Thank you, Rick, for finally getting all this together.
Don't shake it.
What should we do now?
One rescue.
One rescuer and 10 patients.
And if you CPR.
That's like Squid Game. Who's gonna survive?
Yeah.
I have not watched Squid Game. I don't really want to.
I haven't either.
I don't think I need that in my head.
It's good.
I heard it's well done, but that doesn't mean, a lot of people say that about horror movies, and I'm not really into that.
I don't love horror movies
So it's
that,
like
like,
capitalist hellscape. So
What's that?
Squid Game is almost like capitalist hellscape.
oh, totally.
You know, you should watch it.
It's not
Mr. Beast.
Super, isn't that just
It's
watching
not
videos?
super South Korea, right?
No, but yeah, that's like the worst part about it.
Is that it's a little bit too close to home?
What's the Mr. Beast show called?
Sort of like.
Oh
Handmaid's
yeah,
Tale.
I keep getting ads for that.
It's good.
His game show. Is it
It's a
good?
show?
Yeah, Mr. Beast has a show on
Amazon.
Amazon.
Who?
Mr. Beast.
I thought you were talking specifically about the video where you
Heard of
made
this.
squid characters.
That's okay. There is a Squid Game.
How many
game.
CPR dummies can Mr.
There is.
How did that happen?
Oh.
Mr. Beast
Because they're survivors, people like it. Like shows that people are eager.
I got an ad on Instagram yesterday for the Survivor style show, and this one was wearing
Mark Burnett should be
We're
doing
like,
this.
in our survivalist do this
The
one.
whole
Ironic.
Survivor.
I have to watch this.
Yeah,
Why
I
would
personally like our
promoting that kind of behavior on the trail?
They proliferate.
Trying to survive on this little
What would
planet.
that be?
Reproduce.
Everybody's stabbing each other in the back.
Because they do produce open.
Alright.
Mr. Beast.
He's a down. No. Who's Mrs. Beast?
Hey, yo.
Is there a Mrs. Beast?
Alrighty.
A baby Beast?
Mrs. Beast is my mother.
Now that we're done with the CPR portion,
Good.
I do not. I'll stop. Hey, Bailey, did you find out anything about hypothermia?
Yeah, I mean, I feel like I vaguely remember having talked about it in the past, where like there's some evidence that people can like